Hi everyone, we are Team covID at Cal, and we're presenting in the Jacobs Spring Showcase Coronavirus Design Challenge. Just a quick introduction. We're a group of 3 Berkeley students, Spencer Lay, Michael Savides, and myself, Rashab Parek. So we were all inspired to create covID at Cal because we saw the issues that coronavirus was doing to destabilize communities and shut down schools, including Berkeley. We wanted to solve an addressable problem that we all experienced through coronavirus. Basically, none of us want our college experience to be cut short or defined by the impact of coronavirus. We would all love to be back on Sproul in the fall with our friends and classmates. However, we understand this might be difficult because we know there needs to be significant progress that needs to be made. We feel that universities across the country, including Cal, could be doing a better job with coronavirus communication and prevention amongst the student body. So, in order to understand the topic that we're talking about today, we first need to get some scientific context into COVID-19. We believe that before implementing solutions, it's important just to get some scientific knowledge. So, like, for example, uh, the rise in coronavirus outbreaks is extremely alarming, and it's making it more important to take actions today. It's spread through water droplets when we sneeze and cough, and it's extremely contagious and dangerous, especially on big social areas like college campuses. Additionally, until a vaccine becomes available, health officials have stated that social distancing is the best remedy. Social distancing is extremely effective. If we take a look at the number of COVID infections in China currently, which is in the top left of your screen, if they had started containment 1 to 3 weeks earlier, those maps would have been extremely different. Additionally, 3/4 of hospitalized COVID patients have had at least one underlying condition in the United States. So using these facts, it's important to note that currently the policies surrounding social distancing are like really not data driven. It's a standard policy just to stay at home and stay 6 feet away from each other. But eventually, as life slowly heads back to normalcy, people will want to know the current risks that they are at all times. Current contact tracing methods use like Bluetooth technology or other phone to phone connections. They do not capture one's dynamic health data, their variable health symptoms, or even static health data in creating risk assessment and contact tracing technologies. This is where our project, covID at Cal, comes in.
Hey everyone, my name is Michael, and I'm going to start off by telling you a little bit about our project. What is covID at Cal? So covID at Cal it's a Berkeley specific and really university specific in general contact tracing and risk assessment app. And unlike other apps that are on the market or are being discussed putting into place, this is really a university specific mechanism for contact tracing and also providing individuals with specific risk assessments based on a personalized health profile for each individual. So as you can see here, it enables students to receive personalized location safety ratings for pretty much any building on campus based on their health profile and any sort of pre-existing conditions or ailments that they might feel at a certain time. So in addition to just being a risk assessment app, covID at Cal also enables contact tracing that will let any student know if they may have come into contact with someone who has tested positive for COVID-19. So we really saw a student need here. We did a survey of 100 students on campus, and 87% of these students said that they wanted to be back at school on campus for the fall semester. And this survey also asked students to rank from a scale of 0 to 10, with 0 being extremely uncomfortable and 10 being completely comfortable. How comfortable were they feeling about coming back to school in the fall? And students they said around 6.5. That was the average of the 100 students that we surveyed. And this is okay. It shows that students are relatively comfortable, but we think with the measures in place, we can get that 6.5 up to maybe an 8, 9, 10, which we think could be great. Students, they really want to go back to campus, but they just don't know if it's time, and they don't know if there's measures in place that will make that transition seamless and safe. And although our idea is not the only solution that will solve every single problem with COVID in the next year or however long this persists, we think it is another step in the right direction that can provide a safer school year to thousands of students, both at Berkeley and on other campuses all over the country. How does covID work? So every student has their own personalized ID code that they scan into a building when they enter and when they leave. So phase one of our implementation will focus on lecture halls, which are ideally the best locations to start, as there are a lot of students in one single room, a lot of people put together, and often in very dense locations. So this ID allows for students to be tracked where they have been at what times, and all of this location data will be stored securely on a server and will not be used at any time except for when an individual that they might have come into contact with has tested positive for COVID-19.
As you briefly saw before, that was our app design. And so simply we can break it down into our entire user interface design, which we included here. And as you can see here, the locations of various elements we intend to include into our app are mapped out here.
So here's a little bit more about the personalized aspect of our app and how it can help every single person get a personalized assessment of how safe it is to enter into various locations on campus. So here's an example situation that you can see. Rish, my fellow group mate, so he enters his health data. He enters a little bit about himself and any sort of pre-existing conditions, and this will be talked a little bit more on the next slide. But after Rish enters this data, he gets placed into a group. So risk group A represents the individuals who are most at risk, and there's risk group A, B, C, D, and E, which all represent various groups of individuals that experience various degrees of risk when it comes to contracting COVID-19. And this allows students to get a personalized view of what locations on campus are safe for them to enter and which are not. And this also, being placed into groups like this, risk groups, it eliminates the need for the health data to leave Rish's phone. It won't be stored on any server, it won't be stored anywhere, and it will basically just only go towards putting Rish in a risk group that will then determine everything else and the location safety ratings of every building on campus. Rish is never notified what group he is placed in. It's basically just a behind the scenes aspect that allows that data to not have to be sent anywhere else besides within Rish's phone, putting him into a group. And as I said before, this risk group directly determines the location safety ratings displayed on the app. So these are the questions, at least a preliminary group of questions that are going to be displayed on the app and will ultimately determine what risk group each student will fall into and how safe every building on campus is for them to enter. So as you can see here, age, height, and weight, and then it goes into pre-existing conditions that might impact the severity of contracting COVID-19 or how easy it is for someone to contract the disease.
Now, how exactly might everything work, you may be asking yourself? Well, here we're going to finally dive into the technology behind our idea. As you can see here, when a user first gets the app, they're going to be punching in their own data with their medical survey, like risk assessment factors, whatever. But the main thing is what's firstly going to happen is when they download the app, they're going to be getting their own personal QR. And as you can see, this is basically just a little diagram that helps highlight how the flowchart will work. Next slide. And so the covID QR code is really specific and unique because it's actually a QR code that you can scan in and out, as previously mentioned. And it's built upon static data and dynamic data, which is an important factor that Rish previously mentioned.
So here's the process for assigning basically how we're going to alert students of whether a building is safe for them to enter or is a little bit too dangerous based on their health profile. So our algorithm basically takes into account three things when determining the safety of a building on campus. Firstly, the number of individuals that are currently in that building. specifically the density of people based on how big that location is. And here's an example for our phase 1 rollout. In a lecture hall, for example, you could divide the number of total lecture hall seats divided by the number of students in that lecture hall at that given time, which will kind of give you a picture of how many students there are for every space within that lecture hall. So we think this is a good first step in basically, okay, this building's a little bit more dense, there's a lot of people in here, it might not be exactly safe to enter, higher chance of coming into contact with other people, and specifically someone who may or may not know that they have COVID-19. Second thing it's based on is the risk grouping of a user. For example, an individual in risk group A, which are usually the high-risk individuals, they might have a yellow rating for a given lecture hall at any specific time, while someone in risk group E, that very low risk, healthy people, no pre-existing conditions, they might have a green rating. It might be safer for those individuals to enter that building. And thirdly, this rating is also dependent on whether or not a case of COVID-19 has been reported in that lecture hall. And what that would take the form of is if an individual gets tested at the Tang Center and the test comes back positive, they have COVID-19, then all of the lecture halls that they had been in will now receive a red rating, and that will be specific to not one risk group. It will be for everyone. That lecture hall is now at a red and people should not go inside. So this is a little bit about how the test response would work. So the Tang Center would be basically where we think most students will be getting tested for COVID-19. And the Tang Center in the fall, they should have basically testing available to anyone who wants to get tested at any time, regardless of whether they experience symptoms or not. But basically testing will be very much widespread throughout everywhere come the fall. But Tang Center basically has admin data access to this application, and it allows them and only them to trigger the contact tracing notifications. You know, we wanted the medical professionals to be the ones who are able to have this, the ability to trigger the contact tracing mechanism, because we think if it's just in the student's hands to self-report, I think that could get potentially misused. And it's also just great to loop in the Tang Center to this and make sure that every one of these cases is a proven, completely tested positive case, so that we're not overreacting and that we're not missing cases and allowing students to continue going into buildings when it's in reality it's not safe. So basically, assuming my group mate Rish tests positive, for example, any other students who had visited any lecture hall that Rish had been in on that same day or in the 2 days previous will be sent a notification on the covID app, which looks a little bit like you can see here on the right. And as well as that, any lecture halls that Rish had entered in the past 24 hours will be immediately assigned a red rating, regardless of risk group. This will be for all students, meaning that everyone should avoid those areas for the remainder of the day until further cleaning by the part of Cal Utility Services. So this is another area of the app that we have that basically allows for any sort of breaking news, any updates from the university, from the city, from basically anyone about COVID, or just things that students should know. This building is not safe to go in, for example, large amounts of cases reported in this one area. You know, there's really a lot that this can be done, but we thought there was really a need for this sort of update section. And here, as we've shown, there'll be a little section about what is covID, how to use the app, and this is where any sort of questions can be answered, as well as an example here, 3 more cases reported in Berkeley, just a very direct way for students to hear about what's going on.
Yeah, so as you can see, there's a lot of complex and moving parts. So I think it's really important to break down and get a really high level overview of our product and basically its architecture. So let me just break it down to a quick user case. Let's say we have 3 users who have their phone with their QR codes as demonstrated above, and then they scan into Wheeler Hall. Let's picture Wheeler Hall. The up arrow and down arrow denotes that they can scan in and scan out. And all simultaneously, this would directly go to both our servers and our database, as you can see, which is demonstrated by the cylinder-looking disks to the right. From there, the app and basically our API can send requests, in case we want to access the location, like user 4 wants to access their location interface, this will directly go to the database and it'll run some code and it'll give them their specific risk assessment. Similarly, at the same time, let's say the user 4 sends in another request and they want to get more analytics, or they want to get notified actively whenever something happens. This is also good because from our database, we can also set up another service or system that basically takes that live data and basically filters it out and sends it to the user 4 whenever they want to.
Great. So now let's take a look at our primary use cases. So the primary use cases would be when a person walks into libraries, dorms, or university buildings. Additionally, we hope to expand to other Berkeley local restaurants, such as Cheese and Stuff and Thai House. And we also hope to conduct prediction analysis. So based on specific times of the day, what locations are more dangerous or less dangerous. The colors would fluctuate based on that, but those are most of our primary use cases. So our secondary use cases, there's a lot that we can do and a lot of potential with covID at Cal. We can add new sources for dynamic data, such as health metrics, connecting people's iWatch or their iPhone, their travel logs, or any other health and wellness related application to our platform, which can then add a variety of secondary use cases based on scanner apps. It could also help emergency workers, airport scanners, and doctor's office scanners by implementing similar technology in their offices. Furthermore, similar to what Michael was explaining with the news updates, we, through the application, hope to create and deploy personalized medical advice. So through the moderator account that the Ting Center would have, they can connect with individual students who can really receive access through telemedicine through the chatbot portion of the application, which really spreads the accessibility of covID at Cal. Additionally, data-driven insights. So what we're basically doing with covID at Cal is collecting lots of self-reported medical data, though we're not exactly storing it, we're grouping it and grouping students into specific groups. So this anonymous data will really be able to allow us to train models to really predict user responses. It'll allow us to answer the following questions, such as what room has a certain capacity? Do we have to cap large lecture halls? Do we have to cap libraries? Are there correlations between sanitation stations and the red, yellow, and green zones? What's resource allocation do we have plans we have to implement? Do we have to put specific hand sanitizing stations in specific areas of the campus versus others? It'll really allow us to get strategic and data-driven with trying to figure out all these problems.
Like Rich was kind of saying, there's really a lot that this app can do, and it can be used very easily by the administration. And we think there's a lot that coordination with covID at Cal can do to benefit really the university in general. And we think that, I mean, first of all, the data that our app will generate will help the university and those making the decisions on campus to decide, well, this building is not necessarily safe for students. It's really been a hotspot for COVID-19, and it's a lot of people just not safe. Let's shut it down. Let's stop classes there for the next few days. Let's do a thorough cleaning. So these data-driven insights are really going to help the university to kind of get a good idea about what they should and shouldn't do. And as I've written on here, COVID-19 can live on plastics for 2 to 3 days, wood for 4 days, and metal for 5 days. And these are really the materials you're going to see in these classrooms. And that's also why we think that this works in coordination with thorough cleanings that will happen on campus, that we've heard will happen almost every day. And I think that's definitely a big process, but the data that our app will generate will really aid in a lot of these processes.
Now, our product's design wasn't necessarily always polished. At the beginning of our project, we actually planned to calculate a unique risk score, which was basically going to be a number for each individual based on their self-reported health data. Now, this could be very confusing because, I mean, I'm a CS person, like I like numbers, but that doesn't necessarily mean that the next person will necessarily understand every number that's thrown at them. So we decided to focus more on the human-centered design aspect of things, and we decided to tone it down and use colors instead. And As we decide to focus more on university-specific things, we see our most feasible plan is to roll out covID in multiple phases, contrary to our original idea, which was to use it everywhere. So our phase one would probably be lecture halls. Our phase two will be classrooms and student spaces, and even restaurants on campus. And then our phase three will be residence halls.
Great. So what are our future directions? Well, we're at covID at Cal. We're really excited with what we've done, and we hope to implement on campus for the fall and future semesters. But we really believe that this type of model could happen at any other university, public or private, across the United States. And we hope to create covID at insert college name, whether it be UCLA, Stanford, University of Michigan. We hope to create those types of chapters at other campuses as well. So students, leaders over there, along with campus administration and health officials, can create a safe and welcoming place for students so they can be back in fall and enjoy the rest of their college careers. Thank you so much for listening to our presentation. We welcome any feedback. Please reach out to us at our emails at the bottom right. And yes, appreciate it.